Oh my, knocked you for a loop. It was terrible. Okay, and he couldn't understand why he was having all these infections. But we explained it to him. Not being circumcised is not a bad thing. But what is not a good thing is if you don't retract the foreskin and clean underneath the, clean the head of the penis and the glans penis. So you need to teach him. So when parents, young moms who just gave birth, some moms just adamantly will not circumcise their kids. Not a problem, but you need to teach them about retracting the foreskin, and you need to tell them that from day one, they need to be teaching their kids to do the same thing. Okay, this man, nobody taught him. Nobody taught him. You also want to palpate the penis and the scrotum. Okay, and if the left testes is lower than normal, you know what? If the left testes is lower, it is normal. I had one of my neighbor's husbands, because I went through this whole thing about testicular self-exam with him, and DRE and stuff like that. I went through that whole thing with him. And I said, you need to check your testicles and make sure that they are equal and symmetrical. Okay, this is what I said, equal and symmetrical, and there are no bumps and lumps and everything like that. He calls me in a panic because his left testicle was lower. And I said, no, it's normal. But see, sometimes when we say something, we know what we mean. But are we really expressing it so that the other person can completely understand? We have to be careful about that too. Okay, you want to test the testes. You want to look at the scrotal sac for cryptorchidism. Okay, and what is that? Well, if it's a non-tender, then it's probably it's like a bulge, cryptorchidism. If it's non-tender, then it's probably a hernia or hydrocele. If it is tender, then it's something called epididymitis, or it could be a strangulated hernia. Yes, sometimes the intestine can herniate into the testicles. Yep, sometimes it certainly can. So you want to look at that. The other thing you want to look at also, you're going to check his rectum and his prostate. Okay? When a guy is getting ready to get his rectum, his prostate checked, the DRE, you got to tell him to stand pigeon-toed, his toes pointing inwards and then bend over. You want to know why? He cannot tighten his butt cheeks that way. Try it. Come on, guys. Try it. Stand up, point your toes together, and bend over. You will not be able to tighten your butt cheeks. Okay? And so you'll be able to examine very quickly and very fast. Whereas if he stands normally and bends over, he will tighten those butt cheeks when you get close. And then you've got to go, man, you push him aside and everything. That's kind of tough. So point the toes inwards and bend forward. When you're checking a guy for hernias, you want to tell him again, you know how when doctors, proctologists do tests, they put their finger into the rectum and they say bear down and cough? Okay, do you know what they're checking for? They're checking for possible hernias that could herniate through that wall as well. So, again, bear down and cough, that sort of thing. You want to check that way they can check for any kind of hernias in the inguinal and the femoral area as well. In the United States, this problem is becoming more and more common, infertility. Infertility is the inability to conceive after 1 year of regular intercourse. And regular meaning 2 to 3 times a week, not once a month, okay, without using contraception. You all know this. How many of you here know of some couple that's been trying to have a baby for quite a while and then just has not been successful? Raise your hands. I want to see. See? There you go. Quite a number. Now, you've got primary and secondary infertility also. Okay, and we'll talk about that in a sec. Actually, let's talk about it right now. Primary infertility is when you've never been pregnant and cannot conceive. Secondary infertility is if you've had kids, but now you want to have kids and you cannot conceive. After 1 year of trying and having sex 2 to 3 times a week, you still can't conceive. Now, you're not infertile because you had kids before, but now something's happened that you don't, that you can't. So you are infertile, but you're not infertile if you get my drift. Okay. Male causes of infertility include mumps. Now, if you get mumps when you're a baby or when you're young, it's okay. Pre-puberty mumps for boys is fine. It's post-puberty mumps that could cause infertility. Another cause could be decreased hormone production. Now, I'm going to tell you a nice little story about my husband. He's not here, so I can tell you this, okay? For the longest time, he was very tired, and for the longest time, we were trying to have a kid, and we just couldn't have a kid. So anyway, for just some unknown reason, the doctor that he went to, not even the OBGYN that we were going to, his primary doctor said, let me just run a hormone check on you. And he ran a testosterone level. Now, the normal testosterone level on a guy should be in about the 250 level. His was 110. It was that low. So they gave him testosterone shots, and then we got pregnant. So it was very nice. Infections can also cause infertility. And when I'm talking about infections, I'm talking about STDs. Okay? A guy can get STDs just the same as a woman can, and if he has continuous episodes of STDs, that can cause infertility. Radiation or chemotherapy, obviously, as we know, that can cause it as well, because it can kill all the sperm. Alcohol, too much alcohol can do it as well, can certainly kill all the sperm. And an elevated scrotal temperature. So one of the things that we ask men is, what kind of underwear do you use? Do you use that Fruit of the Loom or Speedos? Okay, or do you use boxers? Now sometimes, a lot of times actually what we will tell guys is that if the couple has been trying for a while to have a baby and have been unsuccessful, what we'll tell the guy to do is, those Speedos and the Fruit of the Loom, can them. Go buy boxers, because you need to wear boxers for a while. Why? Because when you wear those tight underwear, what happens to your scrotum? They're pulled up against your body, right? They're pulled up against your body so they stay warm, and the sperm gets warm and hot, okay, and it dies. So you need to let it all hang out, guys. Just wear those boxers and let them, if you really want a baby. Okay. A varicocele can also cause that, and what's that? That's fluid in the scrotum. Okay, some of the female causes. Well, abnormal ovulation. Now, some women may have a very regular cycle, like every 28 days or every 30 days or whatever. They may have a very regular cycle, but they may not ovulate with every single cycle. So abnormal ovulation. How about the women who have, ovulate have a period every 3 months? That certainly can do it too. Okay, now I'm going to get on my bandwagon about birth control pills, and the patch, and the Norplant, and all that other stuff. What's the purpose of a birth control pill, and what does a birth control pill do? Or the patch or the Norplant? What it does is it tells your body, don't ovulate. Right? It mimics pregnancy, so it tells your body, don't ovulate. Well, if you are on the birth control pill, and you stay on the pill for 5, 6, 7 years, what have you just done to your body? You've just told your body, don't ovulate for 5, 6, however long it is that you stayed on the birth control. Well, you know what? Your body finally got the message, right? It's not ovulating, period. You come off the pill, try to get pregnant, forget it. Because your body says, got the message, not going to ovulate. You told me not to for 5 years. So what I'm saying to you is that if you're on the pill, if you're on, Norplant or whatever, if you're on the patch, you need to take a drug holiday. If you're on the pill every year, you really should take a drug holiday for about 3 months until you get one regular ovulatory, a good period. And then if you want, you can go back on it. Because you need to be able to tell your body, you know what, hey, I was just kidding. I really want you to ovulate. Okay, you want to be able to do that. Now, the patch or the Norplant, okay, you've got the estrogen patch and you've got the progesterone patch also. Now, some of these patches are really, you don't ovulate at all. You have no periods at all with them. If God had wanted us to not do this, that's the way He would have made us. So when you just don't even ovulate, not only do you not ovulate, you don't have a period. What are you telling your body? You are definitely sending a message to your body, don't ovulate, don't prepare the endometrium. And I know of people who have come off the patch on the Norplant after having been on it for 3 years, try to get pregnant, and sometimes we get them to ovulate by giving them Clomid, but the uterus, the endometrial lining just says, forget it, I'm not doing anything. Doesn't prepare. So just be very, very careful if you're on any kind of drug. Another thing that can cause female infertility is maybe the fallopian tube obstruction. And for this, to diagnose the fallopian tube obstruction, we do a test called the hysterosalpingogram. And what essentially happens is that you put a catheter, a scope up the vagina, up the cervix, okay, and then you look at the fallopian tubes to see if there's any obstruction. And the beauty about this is that if there is a micro obstruction, they can actually blow that obstruction out. So that's pretty good. Any uterine abnormalities, some women have only half a uterus. So any uterine abnormalities cause that. The use of diethylstilbestrol. Now, you remember this one? Years and years ago, it was given to women as a tranquilizer when they were pregnant. And they found out one generation later that the children born to mothers who had taken DES were more prone to cervical cancer and were more prone to infertility. Okay, so and then there were some people who were still taking DES. Now, actually, DES can be a cause of infertility. Sexually transmitted diseases, particularly multiple ones, which obviously can cause pelvic inflammatory disease. Repeated offenses of sexually transmitted diseases can cause diethylstilbestrol. DES is diethylstilbestrol. It's a drug. It was a tranquilizer that was given to mothers, guess about a generation ago or two. All right, some of the interventions to determine causes of infertility. The easiest one is to do a semen analysis. Essentially, this is very funny because essentially what we ask the guy to do is give us a sample of your semen. Okay? So if he has to give us a sample of his semen, it means that he has to masturbate. So we give him a little cup, then we say, okay, go have fun. We give him a cup and a Playboy, go have fun. And then he gives us the sample. And what we do with the sample is that we count the amount of little sperm that are around. And not only do we count the number of sperm, but we also want to see if there are any motile sperm, the motility of the sperm. Because it's not just the number, it's how can they swim? Are they alive? So the motility, the movement of it. Because it's the number of motile sperm that counts, not the dead sperm, not the sperm that just sits there and goes, okay, I'm suntanning. All right? It's the ones that swim. We also have a test called the post-coital test. And the post-coital test is we don't do it so much anymore because it really requires the couple to go into the doctor's office and have sex. Yeah, I know. That's really the best way to do it. I mean, they have done it at home, and then then she comes in and she has the analysis done. But in actuality, they found that it's not really accurate. It's not that great, okay, because they actually want to see how fast the sperm swims up. Most times they have to come into the fertility lab, and there's a special room for them. Hopefully there are no cameras. Then there's, as I talked about, the hysterosalpingogram. And the hysterosalpingogram is done to determine whether fallopian tubes are blocked or not. Endometrial biopsy, what we do is we go in and we take a sample of the endometrium to see if it is indeed developing properly or not, if there are any problems with the endometrium. How do we treat infertility? Well, there's several ways. And the basic way, well, I call it the basic, but the most, when I say basic, I mean the simplest way, is what we call the basal metabolic temperature measurement. Okay, and what is this? Well, this is a really fun thing, okay? The woman has to buy a special thermometer to take basal metabolic temperature every morning before she gets out of bed. No, you cannot pee. Before you get out of bed to do anything, you have to take this thermometer and put it up your vagina. Yep. And leave it there for about 5 minutes so you can get a good temperature. And then you look at the temperature. And then you have a chart and you document your temperature. Well, with this BMT method, right before you ovulate, there will be a dip in the temperature. Right after you